These are the exercises beginning on page 106. The first exercise, give meanings for the following suffixes. Number 1, algia means condition of pain. 2, emia is a blood condition. 3, itis means inflammation. 4, megaly means enlargement. 5, oma. This means tumor or mass. 6, pathy means disease condition. 7, rhea means flow or discharge. 8, ragia is excessive discharge of blood. 9, sclerosis means hardening. And 10, urea means condition of urine. Exercise B, give definitions for the following terms. Number 1, myalgia is muscle pain. 2, septicemia means blood infection. 3, uremia. This is high levels of waste or urea in the blood. 4, phlebitis is inflammation of a vein. Number 5, cardiomegaly. This is enlargement of the heart. Number 6, myosarcoma, malignant tumor of muscle. 7, nephrosis is abnormal condition of the kidney. Number 8, encephalopathy, disease of the brain. Number 9, rhinorrhea, discharge from the nose. And 10, menorrhagia, excessive bleeding during menstruation. Exercise C. Match the following medical terms with their meanings below. We have a word bank of adenocarcinoma, cardiomyopathy, esophagitis, hematoma, hepatomegaly, ischemia, leukocytosis, myeloma, otalgia, and pneumonia. So number 1, enlargement of the liver is hepatomegaly. 2, pain in the ear, otalgia. 3, holding back blood from an organ or depriving it of blood supply is ischemia. 4, abnormal condition of white blood cells. This is a slight increase in normal cells to fight infection. This is known as leukocytosis. Number 5, abnormal condition of the lung. Inflammation and accumulation of material often caused by bacterial infection is pneumonia. Number 6, malignant tumor of bone marrow is myeloma. and also known as multiple myeloma. Number 7, inflammation of the tube leading from the throat to the stomach is esophagitis. 8, disease of heart muscle, cardiomyopathy. 9, collection or mass of blood is hematoma. And 10, cancerous tumor of glandular tissue, adenocarcinoma. Exercise D. Underline the suffix meaning pertaining to in the following terms and give the area or part of the body referred to. Number 1, we have esophageal. The suffix meaning pertaining to here is EAL. And esophageal refers to the esophagus, the tube leading from the throat to the stomach. Number 2, inguinal. The AL means pertaining to, and the body part this refers to is the groin, the area where the thigh meets the trunk of the body. Number 3, renal. Again, the suffix of AL here means pertaining to, and the body part this refers to is the kidney. Number 4, vascular. The suffix AR means pertaining to, and vascular refers to blood vessels. 5, coronary. The suffix ARY means pertaining to, and coronary has to do with the heart. 6, pulmonary. Again, the suffix ARY means pertaining to, and pulmonary has to do with the lungs. Number 7, axillary. Once again, ARY here means pertaining to, and axillary refers to the armpit or underarm area. Number 8, peritoneal. The suffix EAL means pertaining to, and peritoneal refers to the peritoneum, the membrane surrounding the abdominal cavity. Number 9, mammary. The suffix ARY means pertaining to, and mammary has to do with the breast. And then number 10, myocardial. The suffix meaning pertaining to here is the letters AL, and myocardial refers to the heart muscle. Exercise E. Give the meanings for the following suffixes related to procedures. Number 1, ectomy means removal, excision, or resection. Number 2, gram means record. 3, centesis means surgical puncture to remove fluid. 4, graphy means process of recording. 5, plasty is surgical repair. 6, lysis is separation or breakdown. 7, stomy is new opening. 8, scopy or scopy is process of visual examination. 9, tomy, cutting into, incision, section. And 10, therapy is treatment. Exercise F. Select from the following terms to complete the sentences below. Our word bank, we have angiography, angioplasty, bronchoscopy, chemotherapy, colostomy, hysterectomy, laryngoscopy, mammogram, oophorectomy, phlebotomy, and thoracentesis. Number 1, surgical repair of a blood vessel using a catheter, which is a tube, balloon, and stent, is angioplasty. 2, treatment using chemicals to destroy malignant cells is chemotherapy. 3, an X-ray record of the breast is a mammogram. 4, puncture to remove fluid from the chest is thoracentesis. 5, new opening of the large intestine to the outside of the body is a colostomy. 6, removal of an ovary is an oophorectomy. 7, removal of the uterus is a hysterectomy. 8, process of recording X-ray images of blood vessels after injection of contrast is angiography. 9, visual examination of the voice box is laryngoscopy. And 10, incision of a vein to withdraw blood is phlebotomy. Exercise G. Write the medical term for the following definitions. Number 1, excessive bleeding or discharge of blood is hemorrhage. 2, hardening of fatty plaque in the lining of the arteries is atherosclerosis. 3, pertaining to time or occurring over a long period of time, chronic. 4, incision of the windpipe, tracheotomy. 5, sharp, sudden, or brief is acute. 6, treatment using cold temperatures, cryotherapy. 7, record of electricity in the brain. This is an electroencephalogram. 8, puncture to remove fluid from the membrane surrounding the fetus is amniocentesis. 9, muscle pain is myalgia. 10, malignant tumor of bone marrow is myeloma or multiple myeloma. 11, enlargement of the heart is cardiomegaly. 12, abnormal condition of the death of cells is necrosis. And 13, disease condition of the kidney, nephropathy. Exercise H. What part of the body is inflamed? So So remember, our suffix of itis always means inflammation. So number 1, we have neuritis. This is inflammation of a nerve. 2, arthritis, inflammation of a joint. 3, salpingitis, inflammation of a fallopian tube. 4, otitis, inflammation of an ear. 5, hepatitis, inflammation of the liver. 6, nephritis, inflammation of the kidney. 7, esophagitis is inflammation of the esophagus. Laryngitis, number 8, is inflammation of the larynx or voice box. 9, encephalitis, inflammation of the brain. Number 10, osteitis, inflammation of a bone. 11, meningitis is inflammation of the meninges or membranes surrounding the brain and spinal cord. 12, bronchitis, inflammation of the bronchial tubes. 13, rhinitis, inflammation of the nose. Number 14, peritonitis, inflammation of the peritoneum. 15, vasculitis, inflammation of blood vessels. 16, mastitis, inflammation of the breast. 17, tonsillitis, inflammation of the tonsils. 18, colitis, inflammation of the colon or large intestine. Number 19, pharyngitis, inflammation of the throat or pharynx. And then 20, phlebitis, inflammation of veins. Exercise I on page 110, provide the terms for the following procedures. Excision of the gallbladder, number 1, is cholecystectomy. Number 2, excision of the appendix, appendectomy. 3, excision of a breast, mastectomy. 4, excision of the uterus, hysterectomy. 5, excision of an ovary, oophorectomy. 6, excision of the voice box, laryngectomy. 7, excision of a kidney is nephrectomy. Number 8, excision of a gland, adenectomy. 9, excision of the large intestine, colectomy. 10, excision of a fallopian tube, salpingectomy. 11, excision of tonsils, tonsillectomy. 12, incision of the windpipe, tracheotomy. 13, incision of the abdomen, laparotomy. 14, incision of the chest, thoracotomy. 15, opening of the windpipe to the outside of the body. Tracheostomy. 16. Opening of the colon to the outside of the body. Colostomy. 17. Puncture to remove fluid from the chest. Thoracentesis. 18. Puncture to remove fluid from a joint. Arthrocentesis. 19. Incision of a vein, needle or catheter is inserted. Phlebotomy. And 20. Visual examination of the voice box. Laryngoscopy. Exercise J. Supply the correct medical term for the following. Number 1. A stroke is a cerebrovascular accident. Clot or hemorrhage in an artery of the brain leads to decreased blood flow, known as ischemia, to brain tissue and necrosis, or death of brain cells. Number 2, a heart attack is a myocardial infarction. Ischemia of heart muscle leads to infarction or necrosis of heart muscle cells. Number 3, use of a machine that filters waste from the blood is hemodialysis. Complete separation of waste material from the blood using a machine that receives the patient's blood and after filtration sends the blood back into the patient's body. Number 4, injection of fluid into the abdominal cavity and then withdrawal of that fluid containing waste material is peritoneal dialysis. Fluid is introduced into the abdominal cavity and then removed. 5, a benign tumor of muscle is a myoma. Benign muscle tumors occurring in the uterus are fibroids. 6, a malignant tumor of muscle is a myosarcoma. Malignant tumors of connective or flesh tissue are sarcomas. 7, high level of wastes or urea in the blood is uremia. This indicates failure of the kidneys to eliminate nitrogen-containing waste such as urea, creatinine, and uric acid from the bloodstream. Number 8, blood in the urine is hematuria. This indicates bleeding in the urinary tract. 9, high number of malignant or cancerous white blood cells is leukemia. Immature cancerous white blood cells are produced in excess from the bone marrow or lymph nodes. 10, slightly elevated number of white blood cells due to an infection in the body is leukocytosis. Normal, mature white blood cells are produced to fight infection. Number 11, normal discharge of blood during menstruation is menorrhea. Lining of the uterus breaks down as a result of changes in hormone levels. Number 12, excessive bleeding during menstruation is menorrhagia. Long or heavy menstrual periods, often caused by benign muscle tumors or fibroids in the uterus. 13, hardening of arteries is called arteriosclerosis. The most common type is atherosclerosis, or the collection of fatty plaques in arteries. 14, use of high-energy rays to treat cancerous tumors is radiotherapy, using high-energy X-rays, gamma rays, and protons to destroy cancerous cells. Exercise K. Circle the bold-faced term that best completes the meaning of the sentences in the following medical vignettes. Number 1. After routine breast self-examination, Nora felt a small lump in her breast. She consulted her doctor, who scheduled a diagnostic mammoplasty, mastectomy, or mammogram. The examination showed a stellate or star-shaped mass, and a biopsy, necropsy, or laparoscopy revealed an infiltrating ductal carcinoma. Nora decided to have her breast removed, hysterectomy, mastectomy, or salpingectomy, although her physician gave her the option of having lumpectomy followed by cryotherapy, thoracotomy, or radiotherapy. So the doctor would have scheduled a mammogram, and then a biopsy would have revealed a carcinoma. Breast removal is mastectomy. And then her physician could have given her the option of having a lumpectomy followed by radiotherapy. Number 2, in addition to her surgery, Nora had a sentinel node biopsy of an inguinal, thoracic, or axillary lymph node to determine whether the cancer had spread. Injection of contrast revealed the primary lymph node, which was removed and microscopically examined. So this would be a biopsy of an axillary lymph node. So that would be in the armpit or underarm. Number 3, Victoria had never been comfortable with the bump on her nose. She saw a plastic surgeon who performed mammoplasty, rhinoplasty, or angioplasty. So this has to do with a nose job. This would be rhinoplasty. Number 4, Sylvia had irregular bleeding in between her periods. She was 50 years old and beginning menopause. On pelvic exam, Dr. Hawk felt a large lobulated uterus. Biopsy revealed a large fibroid, which is a benign or non-cancerous tumor of muscle tissue, myeloma, myoma, or hematoma. The doctor discussed 3 surgical options: removal of the fibroid, blockage of blood flow to the fibroid, which is embolization, or a total abdominal gastrectomy, hysterectomy, or cholecystectomy. So this is a benign tumor of muscle tissue, so that would be myoma. And then the doctor could have given her the option of a full hysterectomy. Number 5, Sam was experiencing cramps, diarrhea, and a low-grade fever. He was diagnosed with ulcerative colitis, meningitis, or laryngitis, and had several bouts of uremia, menorrhagia, or septicemia caused by inflammation and rupture of the bowel wall. So with cramps, diarrhea, and low-grade fever, this would be ulcerative colitis, or inflammation of the large intestine. And he could have had several bouts of septicemia, or sepsis. Number 6, Bill felt chest pain every time he climbed a flight of stairs. He went to his doctor, who did a coronary electrocardiogram, angiogram, or electroencephalogram, which revealed adenocarcinoma, nephrosis, or atherosclerosis in one of his coronary arteries. The doctor recommended angioplasty, thoracentesis, or amniocentesis. This prevents further myosarcoma, ischemia, or leukocytosis, and helps Bill avoid a peritoneal, vascular, or myocardial infarction or heart attack. So he had chest pains. The doctor would have done a coronary angiogram. This would have revealed atherosclerosis. The doctor would recommend angioplasty, and this would prevent this would prevent ischemia to have Bill avoid a myocardial infarction, which is a heart attack.